Hey guys, Tony Maritato here, licensed physical therapist, and in today's video I wanted to talk about manipulation under anesthesia, specifically for patients who are challenged by knee flexion or knee range of motion after a total knee replacement. I've had several videos already posted on the channel, but this is a topic that keeps coming up, so I thought, you know what, let's just record another video. Let's talk about some of the concepts and the theories behind it. And first, I want everybody to understand, I'm certainly not against a manipulation under anesthesia. I think there's absolute benefit to the procedure. I've had several of my patients that have undergone the procedure. All of them have done well. I would say the worst case scenario is they didn't get improvement, but none of them had any negative consequences. Now, certainly there are risks associated with the procedure. There's risks associated with any procedure. But I just wanted full disclosure. I'm not against the procedure. I'm not trying to talk anybody out or into the procedure. I just want you guys to do it for the right reasons. And so recently I had a patient in the clinic. We were discussing the procedure, and that's why it's front of mind for me. And one of the most common, I believe, misconceptions around limited knee flexion, because that's where most people are looking at a manipulation, is the idea that it's purely because of scar tissue. So let's investigate that a little bit. And if there are any wound care therapists or any therapists who specialize in tissue healing, I would love to get your perspective. I think the community would really benefit from a true expert in this space. I'm going to give you the information that I have available, but I'm by no means an expert. So my question is, I have been fortunate to work with lots of patients across lots of different conditions. There's a condition called a joint contracture, where basically the connective tissue begins to thicken, begins to calcify, maybe tightens around the joint. It could be a wrist, it could be an ankle, it could be a knee. And what you see is the person starts to lose range of motion. I had a patient that I was fortunate enough to work with for over a decade, and she was experiencing joint contractures associated with rheumatoid arthritis. And during that time, one of the things that we came to see was, as she was losing range of motion around the joint, it wasn't accompanied by pain. Yes, she would get the occasional flare-up from a rheumatoid and have pain in the joint, but the actual restriction, the actual scar tissue that was limiting the motion, was not associated with pain. Whereas when I see a patient following a knee replacement, and they maybe are under the belief that they're developing excessive scar tissue and that's why they can't flex the knee, there is so much pain associated with end range flexion that I don't actually believe we're getting to the point of restriction. So a couple of things that I want to understand is scar tissue alone is not painful. If you've ever had a cut in your skin or some sort of soft tissue damage, you develop scar tissue. That scar tissue heals, helps to bring the sides of the opening together, but it's not painful. So if your knee is flexing and you're experiencing pain within the knee joint, either in the front or in the back, that's not necessarily associated with scar tissue. And what we need to do is be able to distinguish, why am I limited in knee flexion? If I'm stopping because of pain, it might not be a problem with scar tissue. Now, the counter argument to that, and I want to try and present all sides, is, well, when the patient is unconscious, under anesthesia, and there are some great videos on YouTube showing people getting a manipulation under anesthesia, the joint remains restricted. The knee won't flex even when the patient is unconscious and not experiencing the sensation of pain. My question to that is it possible that we're not dealing with scar tissue, but rather we're dealing with a joint capsule that is simply too tight? Whether it's the sizing of the implant, whether it's the way the joint capsule was closed. You guys, if you follow me, you know that I've said I would much rather have a tight knee, because a tight knee can always be loosened, than a loose knee, because a loose knee cannot be tightened. Stability in the knee is one of the most important functions, and so I'd rather it be too tight and work on loosening it than have it too loose and never gain stability. So when I see a patient receive a manipulation under anesthesia, and even if you have the audio turned up, sometimes you hear this Velcro tearing sound. It's very easy for me to look at that and say, oh, you can hear the scar tissue tearing. You can see the limited range of motion improving. But I still have to wonder, is that truly because the patient, the body, the immune system, it created too much scar tissue? Or are we tearing the restrictive joint capsule that either was too tight because of the closure or because of the implant or whatever the reason, and I'm not blaming anyone for this? Are we simply tearing the fibers in the joint capsule, not really tearing fibers associated with scar tissue? It doesn't change the outcome. The outcome is still consider the procedure, consider having a manipulation under anesthesia if it's been recommended to you by your surgeon. Understand that it's nothing like the original total knee replacement. Yes, patients will report soreness. Yes, there's possible complications. These should all be discussed with your surgeon before making this decision. But I've spent so many years hearing patients blame scar tissue for the limited range of motion. And as I try to investigate and I try to dig into the clinical research and the guidelines, I just don't want people thinking that they didn't do enough and as a result their body created too much scar tissue and that's why they're having this problem. I think if you're going to make a decision, you want to make a decision for the right reason, not the wrong information. So scar tissue, probably not the villain and the enemy that we've made it out to be. That being said, continuing to work on your range of motion, continuing to work on physical therapy, doing the best you can with the tools you have available. That's about the best advice we have right now. So if you guys have thoughts, theories, concerns, questions about the manipulation under anesthesia procedure, I would love for you to share your thoughts. If you want to watch the next video that YouTube is recommending you watch, click on this thumbnail. If you haven't already subscribed to the channel, please do so. I would love to pass 25,000 subscribers this calendar year or more, but I can't do it without your help. So guys, thank you, and I will see you on the next video.